anxiety, relax the body. Watch your thought, because we all know flow of thought is mind. When mind is seen, when you observe the mind, when you witness the mind becomes silent. When mind becomes silent, mind cannot take you haywire. By just observing the thought, you will have a grip over your mind. You can silence the mind. When mind is silent, your focusing, concentration, memory will improve. Your thoughts can be modified. You need not react. You can proact. Watch the thought. When we observe the mind cannot take you haywire without your consent. In any disturbed condition, just watch the mind so that you can control the mind. Now gently rub your palms, close it on your eyes. Slowly open your eyes. Priyanka ji, please start recording. Friends, today our class will be on TCM. Professor Lakshmana Krishnamurthy will continue his session on tomorrow and after tomorrow and Wednesday. Today we will complete the TCM, balance portion of the TCM. I have covered up to distal points. You know, what is 5-element cycle, what is generation cycle, what is control cycle, what is 5 shoe points, and what is, 5 shoe point means what is jingle points, what is spring point, what is stream point, what is river point, what is easy points. We have covered, and we have also covered what is distal points. I hope you remember that. There is no need to revise because it's already covered. See, what we have to know in distal point is, the speciality of distal point is they taps into the body's natural healing system. All the features, all the points, they have the same characteristic feature, but distal points, it has got a special effect on the specific part of the body topographically. Special effects on the specific part of the body. For example, in front portion of the body, as I told earlier, briefly I'll tell you once again. Whenever you prepare a protocol for anything, any disease, from neck to head, neck and head, any part, top of the head, eyebrows, forehead, nose, lips, mouth, ear, or tongue, tooth, jaw, any part of the body, including the brain, we have to include Li4, the distal point in your protocol. Many a times, distal points alone can cure the disease because it has got the capacity to increase the blood and energy to the site of the pain, as well as decrease it by either toning or sedating. So, but the distal points are located not on the focus of disturbance. Focus of disturbance may be from neck to head, but LI4 is located on the hand. From a distance, it will control. Topographically, from neck to diaphragm, whatever the disease, we use pericardium 6 is the distal point. You prepare any disease related to that particular area topographically, whether it is related to lungs or heart or asthma or breathing difficulties, anything, any disease, you have to include pericardium 6 as a distal point while making a protocol. Then for the from diaphragm to navel, upper abdomen, where our vital digestive organs are located, like stomach, spleen, liver, and gallbladder are located. Whatever the disease up to the navel, whatever the disease, you have to compulsorily include stomach 36 is the distal point. Stomach 36 is located in the leg, but it will treat the upper abdomen. Similarly, for lower abdomen, reproductive organs, lower extremities, whatever the disease, we have to compulsorily include SP6 in your protocol. It is compulsory because they are very powerful. Many a times, that single point itself is enough. But to improve the efficacy of the treatment, we can use other points also as per our requirement, whether it is loop connecting point, Z-cliff point, or whatever the point, son point or mother point, according to the need. Okay. And for the back portion of the body, upper back, up to the diaphragm, up to the upper thoracic to head region, cervical region, whatever the disease, we use LU7 is assigned as the distal point, and in your protocol, you have to compulsorily use it. Whether it is shoulder pain, scapula pain, cervical pain, whatever it is, or vertigo, whatever it is. Okay. And for lower back, from lower thoracic, lumbar, sacral, coccyx, and lower extremities, back portion of the body, sciatica, or whatever you treat, you have to compulsorily use UB54. UB54 is the distal point for the lower back. Like that, some other important local points are there, but it doesn't require detailed explanation because, on that day I have covered many of them. So I don't want to repeat it because I have only 1.5 hours time today. At 8:30 we have another class. So concept we have to make it clear. In treatise 1, chapter 5, the other than the topographical 6 part of the body, there are many other, some other distal points are there, which has been in detail it has been explained. It will be very useful from the point of view of treatment. I'm not going to repeat it. In examination, if at all any question comes, it will be only on these 6 points. Okay, even on Viva they may ask, what is the distal point for chest region? What is the distal point for upper back? What is the distal point for lower back, like that? They don't go, other distal points will not be asked. Anyhow, now we'll come to the chapter 6, that is law of 8 influential points, or it is also called special meeting points. Friends, as the name suggests, see, there are certain 8 influential points located on important tissues. Tissues, what is the meaning of tissues? Is group of similar cells which have got a common function. Is it not? Uncommon shape and size, structural, functional, it is same. They become a group. I mean, they become a group of cells become tissue. Group of tissues become organ, group of organ becomes system, group of system becomes the whole body, no? So, see, in our government, we have certain department, no? Like we have education department, health department, defense department, like various departments, agriculture department, like foreign exchange, I mean, external affairs, like that, they eight, I mean, many important portfolios are there, no? For certain specific functions. Similarly, in our body, on 8 tissues, for example, bone is a tissue. For anything related to bone, there is one minister called UB11. Like, you know, for any problem related to agriculture, you go to agriculture minister, he is supposed to clear it. For any railways, there is a railway minister, he will clear it. Any problem. He is so powerful, he will influence the whole ministry from small issues to big issue, anything, he will take care. Minister is so powerful, he is not a clerk. Like that, in our body, there are 8 ministers who, you know, when you use them, result will be immediate and instantaneous, no failure at all. Any problem, from chronic to acute, from small to serious diseases, you can use these 8 influential points. And for example, UB11 is the influential point for bone. Anything related to bone. See, bone is the bank of calcium. So, anything related to calcium, calcium homeostasis happens in parathyroid. Okay, so you can, whatever the disease related to parathyroid, you can use UB11. Any bone anywhere in the body, bone becomes porous, or you know, any problem related to bone, you have to compulsorily use UB11, which is the influential point for bone related issues. Even see, this parathyroid will increase the blood calcium levels by stimulating the release of calcium from the bone. Not only that, calcium absorption is done in small intestine by activating vitamin D. So in other words, when you treat, you know, calcium, to treat calcium deficiency, to stimulate SI, you have to use UB11, influential point for bone. Then conserving calcium in the kidney by preventing its excretion. That is the duty of kidney, but because it is related to calcium, when unnecessary leakage of calcium by kidney, you have to compulsorily use UB11, which is the influential point for bone. Not only that, not only bone, cartilages, muscles, nerves, everything is nourished by calcium. So, for whenever you treat our nervous system, muscular system, bone, cartilages, you have to use UB11 in your protocol, which is very influential point. They are not normal point. They are influential point. The second influential point is called LU9. which is the pulse meeting point or arteries meeting point, or we can say vascular system, vascular tissues of the arteries and veins, which carries pure blood and impure blood. Suppose you are treating varicose vein or anything related to arteries anywhere in the body, you have to compulsorily include Lu9. According to Dr. Wall, treatment on Lu9 improves the lymphatic system of the heart. We know there is a lymphatic system in the body. Lymphatic liquid is nothing but blood, but without RBC. It contains only WBC, which will work like a municipality. It will take out all the dead cells and put it to spleen for burning. And it has got WBC, the defense force of the body, which will eat away or destroy the pathogenic factors. According to acupressure, the pathogenic factors are not virus, not bacteria, not fungus. It is only 5-element disturbance in wind, heat, hotness, humidity, dryness, coldness. It will balance this. So, Lu9 is a very influential point. Apart from that, we all know Lu9 is a point which will be very useful to recall the memory. By chance, in old age, you are unable to recall the memory. Just stimulate Lu9. Automatically, you will get the capacity to recall. You are facing some examination, you have studied well, but you have got a doubt whether you will be able to recall it or not. Just stimulate Lu9. You will be able to recall the memory. Then there is another influential point for the energy in the body. Energy means functional qui, functional bioenergy, CV17. Because it is located in the chest area, CV17 will be very good for anything related to respiratory system, asthma, heart attack, or anything related to energy in the body. Somebody has got low energy, just to tone CV17 single point, they'll again energized instantaneously, very fast. Quickly they'll become energized. And about Lu9, it is also called the influential point for the vascular system, arteries and veins. It is also called in China, it is called corpse revival point. In China, if a person dies, they will tone Lu9 and watch it for 12 hours or 24 hours. In many cases, the patient will recover because flow of blood in the arteries is revived. That's why it is called corpse revival point. CV17 is the influential point for the energy, qui of the body, which is functional, which cannot be seen, but it can be felt. Whereas UB17 is the influential point for body fluids and blood. Body fluid includes blood. So whenever you treat any disease relating to body fluids and the blood, suppose somebody has got some parameters disturbed in the blood or blood itself is deficient, you tone UB17. Somebody has got urticaria, excess heat in blood, sedate UB17 because it is related to the fluid. Blood is a fluid. Any fluid you want to treat, somebody has got excess fluid accumulation in the body, sedate UB17. Or you want to strengthen the fluid means in the body, tone UB17 because they are very, very powerful point. UB17 can also be used for reducing blood pressure. You can use it, no problem. But you have to use little common sense. Of course, there will be in blood pressure, normally the flow of blood will be high. That's why it can be used in high BP cases. In low BP cases, you have to tone it. See, CV17 is for functional QE, whereas UB17 is for structural QE. That means blood and liquid of the body. Any disturbance, compulsorily you have to include influential point whenever you make a protocol. You have to see whenever you prepare a protocol whether influential point is required or not, like that. Whenever you treat on this, I'm going to complete another whatever has been left out. For example, gallbladder 34 is the influential point for muscular system, including the nervous system. Whenever a patient comes with anything related to muscle, muscular atrophy, muscular dystrophy, weak muscle, so even in nervous system, to stimulate the nervous system by using gallbladder 34, you will get very fast result, guaranteed result you will get. Then for bone, it is UB11. For bone marrow, marrow is the, marrow is what? Innermost part of the body, and
source of red blood cells.
yeah, where RBCs are produced with the help of erythropoietin produced or hormone produced by the kidney. In bone marrow, not only RBCs are produced in bone marrow, even brain contains a marrow, kidney contains a marrow. So whenever you treat brain and kidney and bone marrow, you have to compulsorily use gallbladder 39. Even in single point will be very influential in treating blood cancer. Why I'm telling you this? Because influential points are really, it is named influential because it is so powerful. There is no question of failure at all. See, marrow contains stem cells. It has got an important role to play. So that's why you can use for the balancing, or whenever deficiency is there of RBC or WBC, you can definitely use, yet compulsorily include gallbladder 39 as the influential point in your protocol. The inner reddish brown soft part of the adrenal glands, inner part of the kidney, wherever marrow is there, okay, wherever innermost part of the organ, any disturbance is there, you can conveniently use gallbladder 39, which is the influential point for marrow. Then, see, we all know we have 6 in organs, 6 young organs. Whenever you treat any young organs, whether it is stomach or gallbladder or UB or LI or SI or triple warmer, any disease, you have to compulsorily use CV12, which is the influential point for all young organs. It is called, see, you might have heard about Zhang Fu. Fu means hollow, tube-like organs, young organs. Zhang means there is no hollowness, solid organs, all in organs are called Zhang. So, CV12 will harmonize all functions, not structure, all functions of all the yang organs or any functions anywhere in the body. You have to compulsorily use CV12, which is the influential point. Yang means activity, yang means circulation, yang means heat. By treating this, you can improve circulation, you can improve heat, you can improve function. Similarly, for all in organs, for any structural changes and for all in organs, whatever the disease, you have to compulsorily include liver 13, which is the influential point for any structural problems and in organs. Now, I hope the concept is clear. If anybody has got any doubt, you can ask me about, influential point. Otherwise, we'll move on to Z-cliff point, next chapter. See, once you understand this concept, any questions related to this can be easily answered. In first semester, the questions are very, very simple, objective type. So automatically, once any question in whatever the manner asked, sometimes they twist the question and ask. Once you are clear with the concept, you can easily answer this.
Excuse me,
We'll
sir.
move on.
Excuse me, sir.
Yes, madam. Yeah.
CV12 functional improves function. So of all the yin and yang organs or only yang organs?
It works on yang. Whether actually it will improve whenever you treat any yang organs, whether functionally or structurally, you have to compulsorily use CV12. But for in organ functions also you can use. Whereas in yang organs, you can use it whether for structural or functional, like that.
Okay, so same way for liver 13 also.
Yeah. Liver 13 is basically compulsorily you have to use whenever you treat any in organs.
Structural changes in organs only.
Yeah. Only for liver 13 you have to use. Basically, it will be very useful for in organs. It compulsorily you have to use. Very useful for in organs.
And for yang organs, structural changes, which point we can use?
CV12, whether structural, functional,
Okay,
CV12 you have to use.
Okay, sir. Understood. Thank you.
Yeah. Now, we'll come to the law of Z-cliff point. Friends, you might have heard about the lymphatic system in the body, or cleaning of the body superficially by lymphatic system, or sometimes we use loop connecting point to clear out unwanted excess energy from the organ or the meridian. There are choice. Either you can use loop connecting point, which is the next chapter, we'll come to that, or even lymphatic system. Generally, you should know it is not in this syllabus. Lymphatic system is not in this subject. So, however, that is used for superficial, not in-depth cleaning. Whereas Z-cliff points are used for deep-rooted cleansing. Wherever there is gap in the body, wherever you find in nature also, there is a gap, means unnecessary gathering will happen. Is it not? In the rainy season or for any reason, dampness is created, dust is created, unwanted turbidity is created wherever there is dampness. Ganda lag jayega na. Wherever there is pit, whether it is deep or not so deep. See, whenever there is a gap, there chances of accumulation of any particles, energy particles is there, whether wanted or unwanted. Even in the body, wherever such gap or excess energy is there in the body, It will go and settle in gaps, creating problems. Unnecessary, unwanted energy gathering happens. When something is gathered for a long time, it attracts infection. Its heat is created, inflammation is created, ulceration happens, malignancy happens. So, to treat any deep-rooted infection or ulceration or malignancy, you have to compulsorily use these Ziegler points. See, every meridian has got a deep, these Ziegler points. Whenever in the COVID time, what we have used, we have treated umpteen number of COVID patients, even with what you call, where ground glass opacity was more than 10 or more than 15. See, in COVID, one of the parameters is to check the degree of infection. They use this what you call ground glass opacity. That is, if you slice the lungs into 25 equal parts, like you slice the bread, no, like you slice the lungs into 25 parts. They say 1 by 25, 2 by 25 is the turbidity in relation to the gases or energy in the lungs. 3 by 25, 4 by 25, 5 by 25. We are treated 15 by 25 where death is imminent. By using Ziegler point, it will take out wherever, which part of the deepest part of the lungs, it will take out the unwanted accumulation, turbidity, humidity in the organ. It is very powerful. All the Ziegler points in all the organs. See, to in previous classes we have covered source point also, organ source point. If you tone the source point and sedate the Ziegler point, the entire meridian and the organ's energy is balanced. When energy is balanced, disease is healed, whatever the disease, however serious it is. If you want, you can use loop connecting point for superficial level removal of toxins, Ziegler point for any toxins, however deep it is, you can throw it out by using the Ziegler point. In case of COVID, we also use CV17, which is the influential point for QE. Not only it will improve the QE, because it is located in the chest region, between the nipples it is located, CV17. When you stimulate that, it has got so powerful influential point, it will throw out unwanted accumulation. It gives energy. Breathing difficulties is solved. Asthma is solved. For asthma, you can also simultaneously use CV22 also. I'm just telling you how to use Ziegler point. Friends, Ziegler points is not only useful for chronic disease, even acute disease, simple disease to serious disease, up to malignancy stage, you can use compulsorily. You have to use Ziegler point depending upon the intensity of the problem. Friends, for lungs, LU6 is the Ziegler point. Contravection, loss of voice, hemotaxis. That means, blood from expectoration or respiratory tract is called hemotaxis. That is, LU6. Anything related to lungs, even if by chance a malignancy patient comes, tone the lungs source point LU9, sedate the Ziegler point LU6. Any disease, you will get fantastic result. Of course, you have to use common sense and use other local points, other important points, which we are going to discuss today itself. What other, some important character features of the other points also. So now, for large intestine, it is Li7. Oppressed feeling in center portion of the body, seizure of uncontrollable hilarity. Hilarity means, in Kannada, attahasa they call, And not only that, Li17 is related to large intestine Ziegler point. It will be very useful for treating piles also. It will be Li7 because it moves in wherever the meridian moves. Large intestine meridian not only related to large intestine, it moves up to Li20, it comes here. That is why whether it comes via throat, sore throat you can treat, face swelling you can treat, toothache you can treat, common cold you can treat. See, not only in LA, wherever the meridian moves, the influential, this Ziegler point will influence. Suppose you have got some lump very near to the stomach meridian in the chest area, imagine it or in the breast, some lump is there. Ziegler point of stomach meridian you can use. Or you have to find out which is the nearest meridian that passes through the focus of disturbance and use the Ziegler point. It will take out unwanted accumulation anywhere in the pathway of the meridian. Similarly, spleen, SP8 is the Ziegler point of the spleen meridian. Spleen passes through very close to the lower abdomen where it is close to the reproductive organs. That is why blood stagnation in uterus, acute diarrhea, blood stagnation in uterus, I already told you. Pain in lower back preventing patient from bending down, lower abdomen pain. All this is because, if you use Ziegler point of spleen meridian, which passes through, that is why it is important to understand the pathway of each meridian. If a patient comes, that some, some accumulation in the back portion of the body, some lump-like thing, you have to see which meridian moves, whether it is UB meridian or gallbladder meridian, which moves there, or SI meridian. Treat the Ziegler point, it will take out the unwanted accumulation. That is the importance of Ziegler point. Deep-rooted accumulation, chronic, which is very old, 5 years, 3 years, 2 years, 1 year old, or 10 years old, accumulation. Still you can take it out by using the Ziegler point. Friends, I'd like to tell you my own experience. One of my students' relative was brought to me for treating rubella. Rubella means German measles, it is called. It's an infection. Those ladies who have got SLE, skin disease, if they conceive, the fetus will die within 12 weeks because the collagen of the cells are eaten away by this rubella virus. There is no medicine in the entire world for this. One of my students' relative, she was married 10 years before, 10 years after marriage, she had 7 abortions. Their in-laws are pressing her for a child, but every pregnancy only maximum 3 months baby is to get aborted. There is no medicine in the whole world. The patient was referred to me, my student, and then it is there is in books it is not there. It is not, that protocol was unfortunately not there, but we had to use common sense. I just used source point tone for LISI stomach spleen, Ziegler point sedate, and then spleen sinking spleen quid deficiency, because spleen holds everything intact. So, and she came to me in March, in October on the Vijayadashmi day, she delivered a baby boy. After 3 years or 2 years, she delivered second boy also. I mean, why I'm telling you, we should not get scared by the disease name. You just confidently apply, you will get result. You should have the confidence. You will get the confidence when you have the clarity. Zikrit points are very powerful. See, for heart.
Excuse me, sir.
Yeah,
As you said, we should look out for a meridian which is passing nearby. Suppose on the index finger, where LI meridian is moving, but on the other side of the index finger, which is towards middle finger, where there is a stomach meridian. So if there is a lump that side,
index finger stomach meridian is not there. Middle finger, no. Repeat the question, madam. Hello, will you please repeat the question?
her video got hanged, sir. Maybe she lost the connection.
See, it is very important from the point of view of treatment to understand the pathway of all the meridians. So, the very nearest meridian to the focus of disturbance, foci, where the disease is manifested, that meridian you choose. If you want, you can choose the organ also. By chance, you are treating on the chest region, it is affected the lungs. Okay, lungs, along with that, very close to the stomach meridian passes. Use both the meridians. Zikrit point, sedate, loop connecting point, tone. See, one important thing you can note it down. By using combination of Zikrit points and organ source points, you can treat generic abnormalities and prenatal diseases. When a patient comes for any prenatal diseases, as I told you earlier, GV4, kidney essence is stored in GV4. Along with that, all the in meridians, earth point or source point. Somebody has got congenital heart problem. One child, 3-year-old child comes with a congenital heart problem. Heart meridian, source point tone, for any, not only generic abnormalities and prenatal diseases, for microbes and parasites, for virus, any bacteria, any fungus, in other words, any chemicals, failure of nervous system, central nervous system, ion radiation, body. See, we have energy, energy has got polarity when it is, they control each other. When it is not control each other, free radicals emerge. There will be no control over the cells by the energy. Even in these cases, you can use Zikrit point and source point in combination. See, this will not be asked in the examination, but very useful from the point of view of treatment. For not only that, some patients come for any degeneration disease, where in allopathic system, the regeneration does not happen, maybe due to overage, aging factor, whatever it is. You can use source point tone, Zikrit point sedate. It will regenerate the system, organ. It is so powerful. And see, the Zikrit points are so powerful. For example, somebody comes with anxiety or maniac behavior. See, residence of mind is in heart. So what you have to do? Use the Z-cliff point of heart meridian. It will take out unwanted energy, clear the heart, phlegm misting the mind. Person is confused about the perception, irrelevant talk, schizophrenia. Use the Z-cliff point of the heart. Urinary bladder 63. Shaking of head with the open mouth of infant, trembling of legs, acute cystitis. See, you have to, and not only that, UB meridian, wherever it passes, whatever the problem related to that meridian, use the UB63 Z-cliff point.
Sir, you are telling about degenerative disease. So what about Sir Parkinson? I want to know, sir, regarding Z-cliff point and organ source point.
Parkinson is basically related to the wind element in the body. See, we don't treat Parkinson. There is no Parkinson disease in acupressure. What we treat is liver yang rising, liver indeficiency, blood deficiency, heart fire ablaze, or phlegm misting the heart, like that.
Okay, sir.
I mean, we don't call BP. BP comes for various reasons. We treat BP for excess phlegm, excess internal wind, excess external wind. Like that, various reasons are there. We don't call blood pressure. Blood pressure is the manifestation, but root cause is different, no? Like that. For any disease, for Parkinson, we have a different, method of treating. We have to find out the reason for Parkinson.
Excuse me, sir.
So,
sir, as you said, for anxiety, we are going to use the Z-cliff point of heart, Z-cliff point and organ source point. So for that, you said heart source point we have to sedate, right?
No.
That is,
Source point is always you have to tone. It will improve the energy.
so which point we will be? Okay, the heart Z-cliff point we will be sedating.
Heart Z-cliff point sedate. See, all the earth point of the in meridians are the source point. All the source point of the in meridians are master points of the meridians. By single point, you can balance the whole organ and the meridian. It is so powerful because the prenatal energy is stored in earth point. Earth element point energy is also there. From loop connecting point, when you take out excess energy from the paired organ, it will come to the source point. That is why the density of energy is very high. It is called master point.
Okay, sir, thank you.
Okay. And
Sir,
yeah.
sir, like liver
Yeah.
3 is the organ source point also, and humidity point also. But when in protocol, it is most of the time sedated when liver Q stagnation and all these. So when we are treating it as a source point, then we are not going to mix any other protocol into this.
No. Whenever you use the source point,
we are going to tone it.
Yeah, I have a very good question. I'm going to tell you. Please listen. See, source point will improve the prenatal energy, earth energy. Even though, see, liver is related to wood. Earth is its grandson. Okay. Actually, if you sedate, it will suck the energy. If you tone, what happens? It will balance the energy. But unnecessarily, you should not tone. Whenever you tone, try to sedate the loop connecting point and Z-cliff point so that excess energy is taken out. See, liver is never be deficient, always excess. That is why sometimes we have to use common sense. It's a very, generally people will get confused with this point, but, when there's nothing wrong in toning the liver. But take out the excess energy through loop connecting and Z-cliff point.
You mean to say liver 3 tone and liver 5 and liver 6 has to be sedated? This is a full protocol in itself.
Yeah, that means it will balance the liver meridian.
Because nowadays we always misuse liver a lot, due to which many diseases arise.
Liver is related, it is indicated in the tongue on the left corner of the tongue. If there is excess energy, redness will be there on the corner of the tongue. Right side gallbladder, left side liver. Then you have to sedate the sun point of liver 2. Okay, then excess energy is reduced. Even though you turn liver 3, it doesn't matter. For some reason you want to improve the energy in liver. Liver is for some reason you want to increase the energy. Yes, that can be done, but you have to balance it with sedation of excess energy through loop connecting and Z-cliff point. See, we have to use the common sense, but it's a good question. And then pericardium 4 is the Z-cliff point of the pericardium meridian. Pericardium is related to fire element, no? That means it is related to blood and circulation. So any hemorrhage happens anywhere in the body, especially related to the upper part of the body, compulsorily you have to sedate Z-cliff point. And especially if somebody has got chest pain, whatever the reason, sedate Z-cliff point of pericardium meridian. Or cardiac pain, or palpitation, excess pulse rate, you simply sedate 1 point, pericardium meridian, Z-cliff point. If you want distal point for pericardium is P6, that also you can use. See, we'll take a separate class on how to prepare a formula to prepare a protocol. At that time, we'll tell you other details. Okay. Now we'll only discuss about Z-cliff point. Z-cliff point for triple warmer is TW7. Triple warmer maintain the homeostasis in the body by maintaining heatness and hotness and coldness. Balances, nourishes it through coldness, balance the energy. Hotness is also required, heat is required, it balances. So any fits, convulsion, seizure of all kinds, Z-cliff, it is excess energy in the brain. TW7 single point is enough to treat in acute cases. Suddenly emergency, first point you have to treat is triple warmer 7 sedate. Don't turn the source point in what you call convulsions or fit or seizures. Similarly, gallbladder 36 is the Z-cliff point for the gallbladder meridian. See, one you can treat atrophy of the lower limbs, legs, by sedating gallbladder meridian, gallbladder 36, because see what gallbladder 37 also, loop connecting point. You may be surprised to know that liver is the paired organ. By sedating the loop connecting point, the energy goes to liver, atrophy is stopped. Muscular atrophy is degeneration disease. The muscle cells are not replaced at the proper time. It takes delayed. So whenever you sedate a loop connecting point of the meridian, either partner gets that energy. So friends, there are Z-cliff points related to extraordinary vessels. There are 8 extraordinary vessels. Out of that, yin linking, yang linking, in-hill vessel, yang-hill vessel, these 4 meridians contains Z-cliff point, but it comes in 4th semester. In examination, questions will not be asked. So we can skip that, because now, we are talking about, we are mainly focusing on examination point of view. Anyhow, in the text it has been given. That can be for the timing, we can discuss it later. Now the next chapter is law of loop connecting point, or it is called passage point. These passage points means, or the loop connecting points, the concept is energy can be exchanged between the paired organs in each element. For example, in wood elements, we have liver and gallbladder. In fire element, we have heart and small intestine. We have pericardium and triple warmer. In earth element, we have spleen and stomach meridian. Like that, in all the elements, we have 2 to 1 related to yin, 1 related to yang meridian. No, there are, 2 organs and 2 meridians are there. The energy can be exchanged between these 2 paired organs through a loop connecting point. There is one point called loop connecting point, or the passage point, in each meridian, by which we can transfer the excess energy from one organ, one meridian to another meridian. It's paired meridian. Suppose I got excess energy in liver. Liver meridian's loop connecting point, if I sedate, automatically it will go to the gallbladder meridian. For example, I got some eye related issues. Eye is controlled by liver. I have to strengthen my liver. Gallbladder 37 is the loop connecting point of the gallbladder meridian. If you just sedate it, your eyes is cured. Eye related issues due to deficiency of eye energy is cured by single point, loop connecting point of gallbladder meridian.
Sir,
Because
is this squint also can be controlled with that? Sorry to interfere.
No. Squint is different. That we have to balance the energy there. In which direction it is pulling. Excess energy means it is pulling at one side. We have to watch, and we can easily correct it. That's a different chapter. In treatise 4, there is a chapter on squint. 14, treatise 14. But it will come in higher semesters. Okay. I'm just telling you about the loop connecting point of gallbladder meridian. Imagine, by treating that, your eye will improve, because eye is the flowering of liver meridian. Somebody has got ear disease. Ear is controlled by kidney. You have to strengthen the kidney. Use the loop connecting point of the urinary bladder meridian. Same concept applies for all the meridians. You want to improve the spleen energy, sedate the stomach point, loop connecting point. That energy will automatically come to earth point of the spleen meridian, paired organ. Your lungs is little weak. You want to strengthen the lungs. Go to large intestine meridian, sedate the loop connecting point. Lungs gets energy. You got some nose problem. Nose is the flowering of lungs. Whatever the problem, simply sedate large intestine 6 is the loop connecting, 7 is the Z-cliff point of large intestine meridian. So you have to understand the concept. Number, you can remember later. You got the concept clear, no? Any doubt? See, it is either way.
Sir, in the parotid gland is swelling, which energy is flowing there, which meridian?
For example, see, you have to, I have got some swelling on the face, here, below the eyes. So, my stomach meridian moves there. I have to sedate this meridian loop connecting point. Automatically, this is sucked away.
Stomach 36, sir.
No, loop connecting point of stomach meridian, stomach 40.
Okay, okay, sir. Thank you.
You have to remember, no?
Mm.
Is it not? See, you have to find out, for example, I have got some pus formation somewhere. You have to find out which is the nearest meridian passes through that area and sedate the, for example, my kidney meridian passes through that area. Okay, so you have to take out the energy from there, means you have to sedate the kidney meridian fluid connecting point, or you want to increase the energy in kidney, sedate the urinary bladder loop connecting point. That energy it can be shifted.
Okay, sir. Thank you.
And now, see, this is one you understand. The concept has been, I think hopefully you understand. No, you understood this concept between the paired organs. Similarly, you can even transfer the energy from siblings. Siblings meaning, see, according to organ clock timing, we are going to discuss about Ferrari points, organ clock timings. See, I'm telling you, 3 to 5 is the timings of lungs. Okay, 3 to 5 is the timings of lungs. 3 to 5 in the morning, lungs. 3 to 5 in the afternoon is urinary bladder. If you have got excess energy in urinary bladder and deficient energy in lungs meridian, then also you can transfer between the siblings. Tone the loop connecting point of the lungs meridian, sedate the loop connecting point of the urinary bladder meridian. Automatically, it is transferred from not only from partner, you can even transfer from siblings. 5 to 7 is large intestine, 5 to 7 is kidney. Your kidney is weak, then large intestine meridian, you sedate the loop connecting point, tone the loop, kidney point you stimulate. Kidney will get the energy from its siblings, that is large intestine. Is the concept clear? This will not be asked, these complicated questions will not be asked in the exam, but from the point of view of treatment, this is going to help you a lot.
Yes.
Not only that,
Yes, I understand, sir.
not only between siblings and the paired organs, you can even transfer through loop connecting points from left to right, right to left. In the same meridian, suppose in my elbow, I got swelling on elbow on the LI meridian, large intestine meridian. I can transfer it to left side also if you want. From right to left, right or left to right, according to the need, you can transfer by you stimulating this loop connecting point. If you don't
Same
know how,
meridian, sir? Same meridian.
Same meridian from left to right or right to left, you can transfer. If you have got, simply stimulate through single star magnet or Macy seeds. It will be balanced, still balanced between the paired organ. But you have to choose the loop connecting point between them, between the siblings, between the paired organs. Is the concept clear?
The concept is very much clear, but the problem arises when the patient comes, sir. Although I have gone through the FPUS books, but the problem is this, this is all theoretical. There are certain symptoms. Although like when the liver is affected, the person will be cleanliness prone. Just a second, sir. Will be cleanliness prone, and like there will be many other symptoms. So, sir, maybe any day you take that class, So when we look at the patient, how to diagnose properly, because we lack in that stream. There,
second
what
semester,
can be what as symptoms?
okay, madam. See, in second semester, there is a subject on diagnosis. Okay. We are going to conduct that class also unconnected with the examination. After the examination, unconnected with the syllabus. You know, for the benefit of everybody, we have two separate sessions, one on tongue diagnosis, another on general diagnosis. Not only that, we are also going to conduct a program called Formula to Prepare a Protocol. You keep the formula on your table, any disease will fit into that. You have to refer the formula and apply, that's all.
Yeah.
That's also I'm going. We're going see now today I'm discussing about certain, see, like at alarm point, Ferrari point, law of first and last point. These things you should know. No, that briefly I'm going to discuss it. You know, I'm very much interested in conducting one offline class in Bangalore about formula to prepare a protocol. If possible, I will try to do it on online also for outstation students. Because once you keep the formula on your table, any disease will fit into that simple formula. That we are going to not. This is not the time to discuss about it. See, now we are in first semester, but you can be rest assured we'll teach you everything. When we progress, no, as we progress, our intention is to see that you are capable of treating with full confidence and clarity. That is why we are giving these extra classes, not only from the point of view of examination, from the point of view of treatment is more important than exam. We are definitely will cover that.
Thank you, sir.
Yeah. See, these loop connecting points, you know, all the meridians one on point, what is its important symptoms has been given. That I'm not going to discuss. I just wanted to convey the concept behind this. Okay, for example, now it is shown LU7, loop connecting point symptoms, yawning. Not only yawning, you have to understand anything, you know, loop connecting point can be used for any disturbance, either deficient or excess. Generally, it is used for taking out the excess energy, but it can be also used for otherwise. Even to tone also he can use it. It will suck the energy from its partner. This concept we have to get clear. See, small intestine SI7 for burning eyes. Meaning what? SI7, if you sedate, it takes out the energy from heart. Heart means heat. Burning eyes means canthis. Inner canthis, outer canthis is controlled by heart element. That is why heart energy is reduced by sucking the energy through loop connecting point of the small intestine meridian. You have to understand the concept. Stomach 40 is an excellent point to expel the phlegm. Expel the phlegm. Even weak leg, you have to simply sedate. If you tone the stomach 40, circulation will improve. I mean, numbness will improve. For example, UB58 is the loop connecting point of the urinary bladder meridian. What it will do? Urinary bladder meridian is related to the water element, fluid retention in the body. What it will do? It will, any excess, see, pitted edema we call, no, any excess fluid accumulation. If you touch it, there is a pit. In that case, especially in kidney patients, you will find this. UB58, if you sedate, automatically that water fluid accumulation will disappear. Slowly it will disappear depending upon the intensity of the problem. You can even use stomach party to expel phlegm. Turbidity. Phlegm means turbidity. It is not only related to the phlegm of the chest. Any turbidity anywhere in the body can be thrown out. Any pus, any humidity, unwanted acclimation anywhere in the body, stomach party, UB58. That is the importance of blue connecting point. Just, okay, LU7 for yawning. No, not only for yawning. Concept is unwanted energy can be taken out, can be transferred to either partner or sibling or left and right, between left and right part of the body. See, liver 5 is the blue connecting point of the liver meridian. See, genital itch violently, whether it is testicles or ovaries or anywhere in the, near the reproductive organ, because liver meridian passes through that. Nearest meridian is liver. There is excess energy, excess wind. Wind means itching. Itching. So what you have to do? Liver meridians, blue connecting point, liver 5, you sedate. Excess energy is taken out. The concept you have to understand. So friends, another 2 chapters left, only 15-20 minutes, 15 minutes is there. Shall we take up law of alarm point, or you want to take a law of Ferrari point? Which one you prefer?
Alarm point, sir.
Okay. Friends, as the name suggests, there are certain points in the body which are located on the back side and the front side of the body, which will give indication in advance about the disease in the related meridian. They give alarm. Even before the medical reports will reveal. See, when you come to the 3rd semester, you will learn the disease will set in the first 3 stages. It is called humoral stage. In humoral stage, disease sets in, but reports will not reveal it. Only in the cellular stage, second half. In humoral stage, there are 3 stages. In cellular stage, there are 3 stages. I'm not going to discuss deep about that. But what I'm telling you is, even in the beginning, when the disease sets in, these alarm points will give indicate. The point become tender. When you touch it, it pains. Even without touching, sometimes it manifests pain there. That is an indication body gives that something is irregular, not normal, abnormal, related, wherever that point is, For example, every organ has got one front shoe point. All the front shoe points are related to the in organs, or which will treat in means structural. All the front shoe points are located on the front portion of the body. All the back shoes point are located on the back side of the body. Back is young. Back is functional. All the meridians, whether in meridians or young meridians, whether their function is disturbed, you can feel it by touching that related back shoe point. Functional disturbance, structural disturbance, front shoe points will indicate. The another important feature of this, this alarm point is, it is, alarm points do 3 activities simultaneously. By touching it, it will give you indication, diagnosis. The degree of damage can also be revealed It is called prognosis, how long it will take to cure, how it's going to affect, what will happen in the future if it is not attended. Prognosis and the treatment is also done simultaneously by treating at the alarm point. Another important aspect of the alarm point is both front shoe and back shoe points, if you treat simultaneously, the whole energy in the meridian and the organs is balanced. When the organs' energies are balanced, disease will disappear. Any disease will come only due to imbalance in the energy flow. Energy means, component of energy means wind, heat, hotness, humidity, dryness, coldness is equal to Q according to TCM. So these alarm points will indicate whether wind is excess, heat is excess, hotness is excess, humidity is excess, dryness is excess or deficient, or coldness is imbalance. That is equal to Q. When it is imbalance, whatever the Q, the component of the Q is imbalance, then you can correct it by treating at the front shoe and back shoe points simultaneously or according to the need. Usually, the front shoe points are toned because it is structural. Generally, there are some exceptions. Generally, back shoe points are sedation point because it is functional. Normally, it will be excess. But there are, see, somebody has got kidney Q deficiency. Then we'll tone the back shoe point of kidney, UB23. I mean, there are exceptions everywhere. So,
So that means in first three stage, humeral stage, we should tone front shoe
no,
and sedate back shoe.
no, I'm telling you, these front shoe points and back shoe points give indication even the initial stages. Where when you take the blood test in reports, it will not be revealed. But disease has set in already.
Yeah, so that time we can start treating.
Yeah, when you treat on that point, it will treat also. You not only for diagnosis, it will also treat. Single
So during
point.
the humeral stage.
See, for example, I got something stomach related. See, UB25 is the back shoe point of this, large intestine meridian. Stomach 25 is the front shoe point. If you stimulate both the points, constipation is large intestine means constipation. You can treat by treating on these 2 points. I mean, whatever the disease related to that organ, I got some lungs related issue. LU1 is the front shoe point. UB13 is the back shoe point. Treat both, no, it will balance the energy in the organ. Somebody has
So
come from cough and cold.
Yeah, simply stimulation, no toning, no sedating.
No, front shoe point you can tone, back shoe point you can sedate, or you can stimulate according to the need. We have to diagnose, see, you have to understand the concept by using this. If you initially know in first semester, till you understand the diagnosis in the second semester, you can simply use, what we call, yes, just stimulate.
Okay.
If you know definitely it has to be sedated or toned, you can tone or sedate according to the need. I got some problem in kidney. I will tone. Kidney usually is deficient, no, because it gives prenatal energy to every organ. That is why it is always deficient. Kidney is always deficient. Liver is always excess. So what I will do, I will tone both back shoe and front shoe of kidney. Then kidney performance will improve. Gallbladder 25, UB23. You tone both, kidney deficiency will go away. Only thing is, I want to clear the concept. When do you have any doubts on whatever has been discussed today, up to today?
Sir, in case of constipation, ST25 and UB25 both are to be toned?
No. Constipation is an accumulation. Both has to be sedated.
Okay.
UB25, stomach 25, both has to be sedated.
Okay. Thank you, sir.
See, in heart, usually if it is deficient CV14, if any structural problem is there, tone the CV17. Whereas the back point UB15, see, if it is BP, you have to sedate it, back point of the heart. If heart is weak, low BP, tone UB15 back point, because it is functional. See,
Sir, can I ask you? Hello, sir. Sir?
You are treating spleen. Somebody has got, spleen is responsible for diabetes also. Whenever your spleen means right side of the spleen is pancreas. How to improve the function of the pancreas? Very simple. Liver 13, front tube point of the pancreas. Right side of spleen is pancreas. Tone it. Along with liver 13 is the front tube point of the liver. Spleen front tube point is liver 13. What you have to do? It will improve the quality.
Tone.
Yes, right side meridian of spleen is called pancreas. If you want, you can even tone UB20 because functional.
Yes.
That's what we should learn to understand the problem properly. Diagnosis is very important. And what are the features of all this, whether it is law of alarm points, whether leukocytic point or Z-cliff point or source point or Paishu points or mother point or sun point or what we call control point. I mean, when you understand the concept, it is easy to use these points. There are some more important points. Okay, if time permits, I'll take it on Thursday. That's Wednesday, Monday, Tuesday, Wednesday, Professor Krishnamurthy sir will take on Ayurvedic acupressure. The classes are going on extremely well.
Sir.
I'm looking at,
Sir.
review those classes frequently. I can assure you, you will be a very good therapist without any doubt.
Thank you, sir.
So,
thank you, sir. Very nice
so at
class.
8:30 we have another class, friends. We'll catch up very soon. Now 8:30 class will be taken by Dr. Antim Kumar Jain on previous question papers and location of points. It is also very important. Please attend. Tomorrow's timings I'm going to announce it in all the groups. In consultation with Professor Krishnamurthy Lakshmana sir. So we'll catch up tomorrow. Till then, goodbye and good night.
Thank you, sir.
Thank you, sir.
very much.
Thank you, sir.
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 Sir.
Thank you, sir.
Thank you, sir.
Yeah, most welcome.
Sir, do we have a AK Jain sir class today?
Yeah, at 8:30 we have.
Okay, sir.
Now.
Thank you, sir.
Thank
you, sir. Thank you.
Thank you, sir.
So, do we stay on this line? Sir, do we stay on this line or join?
I will share it, no problem.
Sir, do we have to join another Zoom call or in the same Zoom call?
No,
Another.
Already shared.
Okay.
That is different. Please join. It will be helpful for your examination.
Okay, thank you.